Dr. Chinyere A. Ugaji, MD, MBA, with interest in healthcare, education, leadership, public health. I'm currently enrolled in a master's in public health, course, social and behavioral sciences at Capella University, Minneapolis, Minnesota, and graduate medical education application through the electronic residency application system 2015, and participants in the American Medical Association mock interview session. Welcoming you to Dr. Chiquito Mentoring Iridescence Global Collaborative Ustream YouTube show. Yeah, I apologize for the technical problem. It's currently 8:10 a.m. right now, and I want to apologize for the delay in transmission, and I want to thank you for your patience. So I would like to share this quote with you. At each and every juncture of our history, somebody has been audacious enough to say, we could do better, and most often than not, it's been young people who have done it. President Barack Obama, February 2nd, 2007. This program will mentor and cultivate young leaders of today and tomorrow. And I am glad that they have, and I am proud that they will have this opportunity to serve. I look forward to working with those who are selected to participate. And I want to commend all who apply for their desire to help through public service to forge a brighter future for our country. President Barack Obama, May 22nd, 2009, on the White House internship. Education is the key to success for so many young kids. And my goal, education is the key to success for so many kids. And my goal specifically is to reach out directly to young people and encourage them to take charge of their futures and complete an education beyond high school. First Lady Michelle Obama, January 16, 2014. Education is indispensable to the success of every individual and is the motivating factor behind my graduate medical education curriculum review and interest in the Reach Higher initiative by the First Lady Michelle Obama, inspired by this quote by the First Lady Michelle Obama and a determination to focus on education. Dr. Chinyere A. Ugaji, MD, MBA, October 25th, 2014. I would also like to share my biography with you. I apologize. We have some technical issues. So today we'll go to okay, yeah, yeah. I apologize. We have been able to get back on track with the technical issues. So I would like to go ahead and share my biography with you. The brain, a powerful tool for creating the future. The stethoscope, an astute diagnostic tool. The book, the final piece of the puzzle in creating education. Why did I choose to become a physician? Maybe because I was born a leader. Maybe because I like helping people. Maybe because I think it makes me cool. Maybe because I feel I can be a source of succor, a balm in the midst of disease, poverty, and mental anguish. To be a physician, you have to have a sincere love for people and a sincere desire to help people. 2014 till date, Masters in Public Health, Core Social and Behavioral Sciences at Capella University, Minneapolis, Minnesota. And the current project on domestic violence, graduate medical education application, White House leadership application, non-licensed physician, graduate medical educator, community educator, caregiving certified nurse aide, patient care technician, and successful completion of neuropsychiatric evaluation, objective structure clinical skill evaluation, clinical skill workshops, advocacy with the American Academy of Family Physicians, the American Academy of the American College of Physicians, the American Academy of Family Physicians, the American College of Obstetrics and Gynecology, the American Psychiatric Association, American Pediatrics Association, Dr. Chiquito mentoring iridescence education, and various collaborative organizations. May 2008 to September 2013, Masters in Business Administration, Core Public Health Administration at Davenport University, Transverse City, Michigan. May 2012, separation and legal divorce. March 2012, psychiatry research experience from University of Texas Southwestern Psychiatry Department with Dr. Carol Knott, MD, and Dana Downs, MSW, on psychoeducation and hepatitis C and alcohol behaviors. May 2011 to March 2011 to May 2012. Graduate medical education at Southern Illinois University Family Medicine Residency Program, Springfield, Illinois, after the National Residency Matching Program, paramount in viewing at various graduate medical education programs. As a pregnant intern, knocking the socks off the interning examination of the American Board of Family Medicine interning examination using the program director, Dr. Janet Alba's MD's lexicon, and completing clinical rotations in surgery outpatients, community medicine, behavioral science, family medicine training service, obstetrics and gynecology, continuity clinic, didactics, neuropsychiatric evaluation, successful completion of objective clinical skill evaluation, and termination of residency contract conglomerates of graduate medical education. 2010 till date, research on psychiatric, cultural, and contextual arbitration in domestic violence with personal experiences integrated into psychiatry research from University of Texas Southwestern Psychiatry Department with Dr. Carol Knott, MD, and Dana Downs, MSW, on psychoeducation and hepatitis C and alcohol behaviors, and behavioral science rotation from Southern Illinois University Family Medicine Residency Program, Springfield, Illinois, December 2010. Graduate medical education at Huntsville Family Medicine Residency Program in Family Medicine Training Service with Dr. Mary Cristani, MD, the program director. July 2010, graduate medical education at St. Elizabeth and Mary's Family Medicine Residency Program in Family Medicine with Dr. Saida Zahid, MD, the Program Director Emeritus. May 2010, medical education at Harris Fort Worth Methodist Hospital, Fort Worth, Texas, in internal medicine with Dr. Fidelis Oleni, MD, and internist. March 2009 to September 2009, graduate medical education at Henry Ford Internal Medicine Residency Program, Detroit, Michigan. Paramount to interviewing at 21 graduate medical education programs nationwide, completing clinical rotations working in pulmonary medicine and critical care medicine with Dr. Alvin Bowles, a pulmonologist and critical care physician, and in family medicine training service with Dr. Kimberly Baker Jinal, the program director, continuity clinics, didactics, neuropsychiatric evaluation, and termination of residency contract, conglomerates of graduate medical education. August 2009, United States naturalization and citizenship. June 2003 to December 2003, Doctor of Medicine, American International School of Medicine, Guyana, graduating on the Dean's List magna cum laude in 2007. March 2007, successful completion of the United States Medical Licensing Examination Step 1 with a score of 88 or 212. August 2007, successful completion of the United States Medical Licensing Examination Step 2 clinical knowledge with a score of 98 or 237. June 2007, successful completion of the United States Medical Licensing Examination Step 2 clinical skills. July 2010, successful completion of the United States Medical Licensing Examination Step 3 with a score of 88 or 2. Step 1 with a score of 88 or 212. 2003, United States of America green card with the United States of America diversity visa lottery. January 1998 to February 2003, medicine and surgery, Imo State University, Nigeria, first 10 admission and scholarship. January 1986, January 1992 to December 1998. Secondary school, high school diploma, Owerri Girls Secondary School, 9A1s and 9As and 7A1s. January 1986 to December 1991. Primary school, Unity Primary School, Owerri, Nigeria. First top 3 students and admission to secondary school from primary 5. So that's my biography. And now you're on Dr. Chiquito mentoring Iridescence Global Collaborative Ustream, educational Ustream YouTube show, a Reach Higher and Let's Move initiative of the First Lady Michelle Obama. And we're gonna go to the next section of the show, which is the commonly encountered graduate medical education questions that you encounter even as you go on your expedition for the perfect graduate medical education program for your graduate medical education needs. And the first question will be the question for the interviewer, which could be the program director, the faculty member, the residents, the medical students, or the staff. And that question would be, are there opportunities to do away rotations? This is a good opportunity to learn about the rotations done at various sites apart from the main sites of the graduate medical education program. And then we'll go to the next question, which is the question for the interviewee, which could be you or me, even as we go on the search for the perfect fit for your graduate medical education goals. And that question would be, why are you interested in graduate medical education? And my answer to that would be collaborative research of graduate medical education programs nationwide with um, diverse graduate medical education opportunities and contribution towards healthcare delivery and reform are reasons behind my interest in graduate medical education. And with that, I would also want to talk about last week. We were able to go through the session for the commonly asked graduate medical education questions that you encounter even as you go on your expedition for the um, graduate medical education program for your needs. But we had some, but but unfortunately we had some technical issues last week, and we were unable to have the physical examination session, the virtual grand rounds, which occurs every Tuesday on Dr. Shikito Mentoring Iridescent Education Global Collaborative Educational Ustream YouTube show, a Reach Higher and Let's Move initiative of the First Lady Michelle Obama. And so we are gonna have that tomorrow. It's gonna be a very exciting event. It's gonna take place 8 a.m. as usual, 8 a.m. to roughly around 10 a.m. And we'll learn about the overview of the patient encounter, what constitutes the history taking, the physical examination, the write-up of the normal physical examination, which we've done before on this show. But we're just gonna go through that, just to freshen our skills and our memory, and then we'll talk about a case, and that will be a case of peptic ulcer. That's a very commonly encountered case that you encounter every day, even as you see patients in your in medical school, in residence, and also in practice as a physician or as a faculty member in various graduate medical education programs. I will talk about that with a perspective of what of the structure of the step 2 CS and examination, and then also the step 3 CS examination, and then also the general graduate medical education program formats that you have to document as part of documentation of your patient encounter. So we'll learn about that, and then also we'll talk about healthcare news and what is new in healthcare. What questions do you expect to be able to know? What your fund of medical knowledge should be, even as you take your board exams in internal medicine, in family medicine, in psychiatry, in pediatrics, and other specialties. We'll also talk about overview of collaboration with graduate medical education programs. As part of this session, I've undertaken this independent endeavor in contacting of contacting graduate medical education programs via their websites, via email, and also via phone. And it's been a very interesting opportunity to learn all about the program director, the program coordinator, the residents, the staff, medical students are very willing to share their mission and their goals, and also all about their program and their dedication to teaching residents. And I've been able to glean lots of information about them from their websites, from emails, from replies of the emails, from also the phone conversations, and even from social media. I'm gonna share that with you tomorrow. And then I also was able to gather my information through surveys, through phone collaboration, WebEx collaboration, Ustream, collaboration, email collaboration, and even face-to-face interviews. I've also been able to synthesize this data and be able to, through various research methods, which we're going to discuss tomorrow, which is Tuesday. We actually have talked about various research methods on my show, and I have the slides available for anyone who is interested in learning more about research. And I can also have a collaboration with you via WebEx, via email, or also via phone, and we can be able to discuss more about what constitutes research methods. And then also I also have the data which I actually have been able to gather from these collaborations, and I am gonna share it with you. Coming up tomorrow. And then we are also gonna have a session on healthcare in Spanish. Which is very important because there is a large amount of the Spanish population here in the United States. So being able to communicate and being able to conduct a history and physical examination in a different language, which is Spanish, is actually pretty important. And we are going to be part of this learning endeavor in helping the number of residents and also of medical students, of healthcare workers, to be able to accumulate this skill of healthcare in Spanish. And then also we're also offering free physical examinations. We mentioned that last week. We have a free physical examination bonanza. So you actually get a free physical examination live on this show, and you get prizes. You also get an opportunity to win an iPad, a tablet, and also phone and a phone if you sign up to be the subject of the physical examination session live on Dr. Chiquito Mentoring Iridescence collaborative global Ustream YouTube show, a Reach Higher and Let's Move initiative of the First Lady Michelle Obama. And then I'm also giving out free mock interviews. I am willing to sit down with you and talk to you about the commonly asked questions that you encounter even as you undergo your expedition for the perfect graded medical education program for your needs. I'm willing to have that discourse with you. And we can be able to talk about some questions which we have discussed on this show, and also some questions which we might not have discussed. I'm willing to discuss those questions with you. So just contact me for more information. I'm also hiring healthcare professionals and individuals for my independent domestic violence and project for a commission fee of $50 an hour. I'm also hiring individuals to join my charity work, which is one of my hobbies, which I've shared on this show. I have done the work for leukemia and lymphoma by called Light the Night Walk by the Leukemia and Lymphoma Foundation, and it has been a very inspirational opportunity for me, which is both educational and also a charity endeavor to help those with leukemia and lymphoma. And then I'm also hiring individuals for the Earth Walk South Dallas. This takes place every year, and it's an opportunity to create awareness about AIDS, HIV, and also to raise funds for medication and also for healthcare. For healthcare for patients with AIDS, HIV. So we have lots of educational opportunities and also lots of opportunities for charity events, things that you can get involved in. Whatever things that you can be able to help the populace, the global population. And then also um, I'm also involved in this Reach Higher and Let's Move initiative of the First Lady Michelle Obama, which involves resumed joint custody of my 3-year-old son as a single mother, while achieving my goals of graduate medical education training. We're gonna share, the curriculum of of education. It's quite interesting how how much wealth of knowledge you acquire even as you undergo this educational journey from pre-K to higher education. So we are going to be sharing how you can be able to integrate these at various levels which you may find yourself in. And then also we're going to talk about medical legal medicine, divorce, which can be cultural. I may be divorced in Nigeria, which is my home country, or and still be going through a divorce here in the United States. This affects your education. You have to know about the legal implications of that. Criminal records can affect your education. Bankruptcy can affect your education, and also immigration too also affects your education. So this is all part of medical legal medicine. Which, we have to be able to have an awareness about that. We're going to talk about CPT coding with our case of peptic ulcer tomorrow. And I want to I welcome you to share your opinions. Be interactive. Contribute. However way you can. Your contribution and also your support is what makes Dr. Chiquito Mentoring it really sends our educational global collaborative Ustream YouTube show, a Reach High and Let's Move initiative of the First Lady Michelle Obama. You're able to reach out to the global populace and be able to create educational opportunities and be able to help out the general populace. And with that, it's 8:37 currently, and I want to wish you a wonderful day even as you go out for your interviews, and also and undergo the expedition for the perfect graduate medical education program for your needs. And I want to wish you a wonderful day.